Hi everyone, I hope we are good. Let's talk about learning before practice. Today let's delve into learning before practice. Learning before practice is one of the things that you should know as a newly qualified nurse. And remember, you need to learn before you are able to save lives. So, why am I talking about this? Can you imagine you go to a hospital nurse without any rotation and panic attacks? So there are certain reasons why you should know that you should do rotation. One of the things I want to talk about is the policy. The policy references in the guidelines why you have to do those kind of things. The policy from the NMC mandates every qualified nurse to do 1 year internship or clinical rotation after school before you are given full license. And this is because they some supervision before you become an independent practitioner, and it's very important. You need somebody to hold that hand of yours to do some things in nursing before you become an independent practitioner. Number two, the Ghana Health Service Workforce Strategic Plan also requires that people go through internship. So in the Ghana Health Service, they are just looking at the whole workforce, the whole was including the nurses, the healthcare workers, including the nurses. So in this, they get some competence. So you get some competency-based training, and also you can also get we get distribution of healthcare workers. So you go all these places and then you are able to get an idea of what is happening everywhere. It's an exposure and an experience you don't need to miss. Now, there are international references. Some of the international references that when you go to UK, they call it NHS Preceptor Program. When you go to US, they can call it adaptation. When you go to Australia, they'll call it transition to practice program. When you get somewhere else, clinical adaptation, like professional growth programs. There are so many programs for this, but it is all the same.
Some of the challenges that overseas nurses experience when they come over here, like I mentioned initially, when I came, I thought I'm a qualified registered nurse. I'm just coming to, get into the system and get on with it. That was not a thing. And even now, there is still the process, which is the same.
And these things are to give support to nurses. So this rotation is between 6 to 12 months, depending on which entry level you are putting in. So all these places do these things just to support the nurses to integrate into the practice. It is that we have to integrate. So please don't be too hard on yourself that you want to quit rotation. Do not. There are so many benefits for quitting rotation. So let me give you some of the benefits and the reasons why you should go and do rotation. Number one, you should go and do it because there is holistic clinical exposure. So all the departments that you are going, medical, surgical, pediatrics, ONG, babies unit, ICU, NICU, all these places that you are doing your rotation, you will gain hands-on diverse experiences that you cannot gain it in one day. If you go and get an employment and they put you in just a mail, that's it. But you need all these experiences to grow your career. And number two, it develops your competency in different specialties. So you can decide to choose and focus on one area. When you go here and you realize I have the confidence in this area, you may decide to specialize in that area. Now, number two, it bridges the gap between theory and practice. My dear, there is a whole struggle when you have to leave the classroom and come and do real world situations. It is not funny. So when you do this rotation, it bridges the gap for you. You are able to understand some of the things that they teach you when you are in the classroom. So it is good for you to do rotation. Number three, it strengthens critical thinking and decision making. On the field, that is when you know whether 15 minutes is 15 minutes and 20 minutes or 30 minutes is 30 minutes for you to be checking vital signs. And at what point you have to call for help and all that. It is on the clinical space that you are going to do that. And when to take decisions in emergency situations, it is when you are faced with a situation that you can see that when you see somebody do it, the next time you'll be able to take that decision. Now, number four, it enhances professional and ethic practice. You see, with our professional practice, there are teamwork, empathy, nursing ethics, different team communication, collaboration. You are able to learn those kind of things on the job. So you need not skip rotation. Number 5, it reduces medical error and improves patient safety. At least you will be able to practice a bit, and you have a supervisor. So because of that, you do the corrections. Even though there are errors, we are able to correct them and improve the safety. You don't continue making the errors. Number 6, workforce distribution and rural healthcare exposure. So when you do this in rotation, we do community health, we do mental health affiliation, all that. So you are exposed to all these things as a nurse. So you are not like, you are a general nurse, so you see the bigger picture when you do rotation, and you are able to understand some of the programs that the community needs. Number 7, career guidance and specialty. So you will be able to choose from all the things that you are seeing, so that you are able to make an informed choice and specialize in an area. When you do not go through this rotation, that is when you are confused as to where to specialize and where not to specialize. And now you follow the crowd because everybody is going here, so you have to go. No, that is not what you have to do. So please try as much as possible to go for rotation. Number 8, standardization of the nursing practice. Look, a standard practice. I gave you references. The UK, the US, all these other places.
So that preceptorship journey, and what is there? The question is, what would you recommend that we place into that preceptorship training, and how would we be able to put that in to support our internationally educated nurses? And I'm going to come first to Kat, because I saw you sit forward there with your education hat on.
So I think, guys, with the preceptorship just now, it's really different. It depends on the geographical location. England, Scotland, I'm sure Wales, I'm not very familiar for the preceptorship program in Wales. It's all different. But if you look at it in a bigger picture, it's all the same, that you're assigned with 1 or 2 people that's going to help you guide your way. You'll be given a book, you'll be given a document to do that, and you'll be given a timeline. But the idea here is that not to rely on your preceptor to give you the tasks, so that you will take the lead to do it. So I think what I could advise is ask for the preceptorship program. Sometimes the hospitals could be a bit busy and be a bit delayed upon onboarding our newly qualified nurses, or for the ones who's doing access to nursing, they might be a bit delayed with the workbook, but try and do your follow-ups, because it's already intimidating enough to start somewhere where it's different.
Why run away? If you do it, you enjoy it when you go, to be honest with you. But if you jump it now, before you want somebody at a community health center, now before you are going to look for, please link me, do you know somebody? Nah, you already went there, so you have the contact, you have the people, you know what is going on there. You can really decide to do something if you want to do, without all this kind of stress. You get my point? Okay, the last one is attached to this, like as in networking. The network, somebody needs to recommend you for somebody needs to know you. When you do clinical rotation, you expose yourself to the workforce. Somebody will mention your name and say, yes, this girl came to do rotation, or this gentleman came to do rotation in my unit, and this is what he exhibited, so I am recommending him for this. That is how you gain your blessings. But if you say you are skipping, by the time you realize, you have lost your blessing. So in a nutshell, I am encouraging you to go through rotation. Do not skip it because you are wiser than the status. No, don't. And don't go and pay and get license to come and apply for job. No. We need the experience, and we want to buy your good experience. So please, what I want to do here is that tag somebody, so that the person is encouraged to do rotation. So before you are able to save life. So it's 1 year of learn, a lifetime of save lives. That is the slogan for rotation. 1 year of life, a lifetime for saving lives. So please encourage yourself, train yourself, so that you can lead. If you like this video, click subscribe, share, and then tag a friend to go for rotation. Thank you very much. See you soon.